Well, it is time to spring into sports without spraining all sorts of muscles. We've got SLU Care orthopedic surgeon Dr. Randall Otto joining us with some of the common mistakes people make that lead to sports injuries. Good morning, doctor.
Good morning, John. How are you?
Fantastic. Not injured at all, but not really that athletic either. Is there anything that is universal with all these sports that you find when treating patients?
Yeah, I mean, the biggest thing with the spring sports is people have been hibernating over the winter, and now they're going to be getting out into the warmer weather and starting to do things. And a lot of times they haven't been active enough, and the biggest risk is going to be really overuse injuries. So those are the things that we look at initially whenever people come in to see me, is that they haven't been active. Now they're out there starting to do things, and they start to have aches and pains.
Yeah, so you got to warm up. You got to take it slowly and work into it.
Right. Yeah, I mean, a lot of times you really want to focus on what sport are you getting into, and you got to prepare yourself to get into it. That's going to be having proper equipment, proper shoes and clothing, and then really warming up and stretching to get into it. It's really more than just a shoulder injury or an elbow injury. It's really the whole body. It's a kinetic chain, and if you're going to play golf or tennis or something like that, you have to work on your hip strengthening, your core strengthening, and all of that has to go into play. Otherwise, you're not going to have the proper technique, and you're going to be more prone to injury.
So prevention is very important. Also, what you're using, the athletic equipment, something as simple as the shoes that you wear.
Right. If you have old shoes, then they may be broken down, but you don't necessarily want to have brand new shoes either. You got to warm them up and get them broken in before you go to use it. But you definitely want to have comfortable shoes, comfortable loose-fitting clothing that's breathable, so that you can go out and perform those activities.
All right, so I sprained something, I'm very sore. I got to get ice on it. That's the main thing.
Yeah, the initial thing is you want to rest. You want to avoid doing those activities that really aggravated it. Ice it, take anti-inflammatories, and give it a couple of weeks and see if it gets better. If it does, then great, ease back into doing things. And if it doesn't, then you may want to seek professional help or see a primary care doctor or an orthopedic specialist.
And there's so many things you can do, from cortisone to, well, forbid the surgery, but that's the last resort.
Yeah, typically surgery is the last resort, especially for overuse phenomenon. Certainly if there's some traumatic event, dislocations and things of that nature, sometimes those will require surgery. But oftentimes about 70 to 80% of these things are improved with cortisone injections or anti-inflammatory medications, and then physical therapy. And physical therapy really kind of gets you to understand how to do exercises, how to do posture, how to do stretching appropriately so you can avoid these injuries.
Yeah, the main thing is also to live in the moment. Think about what you're doing. Don't get lost in your head, because that's how many of these injuries occur. Dr. Otto, thank you so much for joining us.
Sure.
SLU Care orthopedic specialist. And if you want more information, we will have that on our website at fox2now.com.